Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an October 28, 2020 special Halloween COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's total case continues to climb with 433 cases in the last 7 days. Dubuque County is close to 5,400 cases and our 14-day average positivity rate continues to increase over 15%. Right now it's at 15.9, almost 16% today. Much higher than the desirable 5% or below rate we want. Just a slight detour over the river to Wisconsin and their data. Earlier this week they climbed to over 200,000 cases. But here's the thing, they reached 100,000 cases in 7 months. And in about the last 38 days or so went to 200,000 cases. That's doubling in just over a month. And that's what happens with community spread of a novel or brand new virus that nobody has immunity to. And it could definitely happen in Iowa. We're at 120,000 cases with a steep increase in the curve over the past several weeks. Iowa's also experiencing another record day for hospitalizations with 596, 32 more than yesterday. And while Dubuque County hospitals are also maintaining their high COVID census with 28 patients, and those are just Dubuque County residents. So I repeat the messages from Mercy One and Unity Point Findlay hospitals. Continue to encourage community members to wear face coverings, maintain physical distancing, limit group gatherings, and practice good hygiene and sanitizing to minimize the spread of the virus. We need everyone to take this seriously to slow the spread. Together we can protect ourselves, our families, and our neighbors. Now let's talk about Halloween, the holiday that keeps growing in popularity for both children and adults. The most traditional way to celebrate is by trick-or-treating, which is allowed to happen in a COVID-safe way in many communities, including the city of Dubuque. So how is that going to be done? First of all, remember that trick-or-treating is voluntary. It's optional, both for the treaters and the households handing out treats. If you don't feel safe having little ghosts and goblins at your front door, don't turn on your porch light. Likewise, as a parent, you don't have to have your children participate in trick-or-treating. There are many other fun things to do to celebrate Halloween, including dressing up, carving pumpkins, decorating cookies, or doing other crafts, decorating your home or your yard, scavenger hunt around the yard, your home or neighborhood. Those are other ideas. How about watching a scary movie or Halloween cartoon suitable for children? Or a virtual costume parade with friends. Household members wanting to do COVID-safe treats for trick-or-treating also have options. You can be creative on shooting treats through a PVC pipe or catapulting them to the treaters. Just do a YouTube search on this and you'll come up with a lot of ideas. For more simple techniques, set out a table by your front sidewalk with treats placed apart as you watch treaters from your window or doorway. Then occasionally replenish them as needed. That's my plan. This will avoid treaters crowding by the front door or running into other treaters while leaving your door. You know, even though I like to chat with the kids and ask them about their costumes, they really don't want to spend time doing that because they want to get on to the next house. Whatever the case, the reality is that whether the treaters come to your door or grab treats from your front sidewalk or yard, their exposure and time with the household is minimal and fairly low risk. Now for adults. We usually celebrate Halloween in different ways, and I hear costume sales at retailers are up. Attending a bar or restaurant costume party or gathering for Halloween at a bar is high risk. For one thing, restaurant and bars are required to have all patrons in a seat and maintain at least 6 feet of distance between tables and bar stools. So no standing, dancing, or roaming around to talk with everyone. And if bars or restaurants violate this provision of the governor's proclamation, they risk large fines or loss of their liquor and food licenses. Likewise, house parties with gatherings from multiple households is also high risk, especially when much of our community spread here in Dubuque County is happening due to smaller social gatherings. Remember that 16% 14-day average positivity rate I mentioned earlier? Top either of those Halloween celebration venues with alcoholic beverages and you have a recipe for COVID spread. due to potentially crowded conditions and judgment for safe public health measures going out the window while under the influence of a couple beers or cocktails. So like the children, adults can always come up with different ways to celebrate Halloween safely. Maybe after trick-or-treat is done, like do a virtual costume parade with your friends, driveway or yard costume get-togethers for shorter amounts of time and while maintaining that 6-foot distance. I'll probably make a stop at our neighbor's fire pit and socialize for a while, standing apart of course, but it will be cold, so I think my appearance will be short. And for everyone, costume masks do not count as COVID face coverings, unless of course they cover the nose and the mouth without opening. Traditional Halloween masks have nose and or mouth openings. These don't help for COVID. Thanks for tuning in today to this special Halloween edition. There's a lot of ideas on the Iowa Department of Public Health and CDC websites, along with local communities' websites and social media. Remember, if we all don't do our part, the COVID virus will get you, my pretty, and your little dog too. Happy Halloween, everybody. Even with all the spooks, witches, ghosts, and goblins, we're all in this together.